Jhpiego. This is the only show where we bring you nothing but the best of choral music.
Masotlamahle, solo, we're still live here at Mavuso Trade and Exhibition Center. We had a technical glitch. Kodwa ke wenjinela bethu ba sebayilungisile ke lenza bethu kanti isikhatsi manje sitawukhulumisa tindzaba taka voluntary medical male circumcision. Voluntary medical male circumcision sinadokotela Bongane Masango. Utasichazela kabanti about that and what they're doing with the Ministry of Health in terms of circumcision. Mr. Masango, dokotela, anguvusele msakatweni sithombe Eswatini TV.
Asivusele nemlaleli ekhaya. And siyajabula kuba la namuhla.
Ever since 2009, you collaborate with the Ministry of Health to combat and fight the scourge and the spread of HIV and AIDS through circumcision.
Yeah.
How has that been and how has that experience been?
When you look at the uptake in male circumcision, from 2009, one will say now it's impressive because it's the uptake is now high. Men are coming up to take the service, but from 2009 there were a lot of barriers to male circumcision uptake, barriers such as cultural beliefs, to say it's not something that is in our culture, some barriers in terms of religion, and barriers in terms of the understanding towards why male circumcision and HIV. Where's the link between prevention of HIV and male circumcision? But then through Jhpiego and other PEPFAR partners, we've tried to talk to people and get to communities to make people understand the link between HIV prevention and male circumcision. And one will say now the uptake is impressive. People are taking. And even here at the trade fair, we've registered people. We have people that have already got circumcised. Nasla showing. Siyabathatha sibamikise ku RFM, sibamikise ku Thembalet, and sekunebantu abasokile manje.
One would then say, luphenyo lendiwe lithi madoda ayasimasi mase kuthiwa sesibhedlela. What is it that you guys have done in trying to do capacity building in terms of motivate men and boys to try and join and participate go voluntary medical male circumcision, and ngiyeva lokho ukuthi i-uptake ithi seyisetule ufuna ukubuto lokuthi yini lenikwendile look different that others can take a leaf from your book?
Okay, one of the things that we've made would say male circumcision uptake is also a behavior sort of thing. So that's behavior change. You need to get to people, make people understand, and also use the people that have already circumcised, their role models and other people, to say, we can do this, and I've done it, and this is how it takes, and these are the benefits. Because you don't have to lie to people. We have to sell the benefits, and also trying to make sure that you address the negative things around male circumcision.
Stereotypes and
exactly. So we've sold the benefits of male circumcision, of which when you look at the benefits, you go both males and females. As a partner of the male that you need to circumcise, what's the role of the female? We've come to talk to females, the benefits to them now as females, and then the benefits to you as an individual male, to say, how then do we link those two? So one will say, bomake basibambisile, ema-females asibambisile, to try and talk to their partners about benefits of male circumcision, not just to you as a male, but to the females too, because I think we'll talk about what are the benefits of male circumcision. But then we are visible, we are everywhere. You look at your public transport, we have branded public transport, we are on Swazi TV, everywhere we are there, Eswatini TV, we are there. We make ourselves visible so that whatsoever question they are asking, they get the answers. We have our toll-free line, which is 2030, where people, they can call anytime and ask any question about male circumcision. What we also do, apart from the toll-free line, we are also there on social media. Facebook, we have a Facebook page where we talk about male circumcision, and people are asking questions, and people, they can book their procedure there on Facebook, and then we link them to the different implementing partners that are doing the actual male circumcision.
Ngiyajabula dokotela lokuthi uthi senza indaba yokuthi you have done behavioral change because so kuqala ku psychological.
Psychological.
Okay. So I like the fact that also you've spoken about the benefits of medical male circumcision, and I want us to dwell much on it and see to break the stereotypes as well, and la corner in the society and in the communities. And I'm sure you guys have done cool in trying to break those stereotypes and lama myths la corner this is what is going to happen to you, and the cultural beliefs as well, and also religious beliefs. And trying to at least combat and also break lama myths la corner in the society.
Okay. Maybe one will start with the last point to say how has communities helped us in trying to talk, because one of the things that's you have, when you go to communities, you don't have to come with new things. You need to go to lama already existing structures. So those are already existing structures. So you talk to those people so that they become responsible for any service, not just male circumcision, but they are the ones that will come to us to say, today we want you to come and teach us about this one. And then, for example, this team in about 15 males or 20 males, and then maybe there are other things that maybe separate team, a soccer kit, but they are the ones that are mobilizing each other to say, I have done it, you can do it, and then by us straight out the team then another. And meetings, community meetings, and then they will call us to say, we want you guys to come and talk about the health issues, because male circumcision is part of the health issues. So that's where we go talk about HIV prevention, HIV treatment care and support, anything that we talk about, NCTs, the non-communicable diseases. So that's how we get into communities. We don't want to invent new things. We go to the already existing structures. That's what we do.
Okay, ngiyajabula dokotela, ngiyakucelela ukuthi singene kulama benefits of voluntary medical male circumcision. Tell us more about the benefits, and I'm sure you've already taught in the communities about them. But umbukele ekhaya ufisile kwathi ukuthi namhla it's my first time ngiva male circumcision. What are the benefits, and what is it that I can benefit as an individual?
Okay, maybe when we look at the benefits, one will start with why we introduced male circumcision.
That's right.
There were studies that were done in different countries, randomized control studies that were done. And those studies, they were done after, like globally, we were looking at the trends of HIV prevalence. And we found that most of those countries where male circumcision is done cultural, it's their culture. When you look at their HIV prevalence, it was very low. So they were like, those guys are doing male circumcision. It's not male circumcision alone that was reducing the prevalence but we needed to consider. And then there were studies that were done. And those studies, they pointed out to say male circumcision has a role to play in reducing prevalence. It does not prevent one from getting HIV, but it reduces the chances of one person getting HIV by 60%. And 60% it's a lot. So we say, then WHO and UNH say those countries with a high HIV prevalence like Eswatini and low prevalence in male circumcision, can they take male circumcision as a prevention, as one of the interventions of preventing HIV? So one of the benefits, it reduces one's chances of getting HIV, which is the major benefit. That's why we push in male circumcision. But there are other benefits. One, the cleanliness. When you are circumcised, compared to some issues of hygiene, it's perfect with people who are not circumcised rather than. And then there are other benefits like sexually transmitted infections. There are sexually transmitted infections that you are not going to get when you are circumcised compared to someone who's. There are other medical issues. For example, ukanza ukuthi now we male, the penis ayikhoni ukuvuleka, le ndvuku ayivuleki. So if ingavuleki kunama diseases such as we call them phimosis. So we then do male circumcision. And then there's another issue now. The partners, how are the partners benefiting? We have what we call cervical cancer now. And one of my causes of cervical cancer is what we call the human papilloma virus.
HPV.
The HPV. So that virus, when you are not circumcised, you can, as a man, transmit it to the female. So if you don't take care of your circumcision status, it means you don't take care of your partner. So if you circumcise, it means you are thinking about the future of your partner, the future of your children. So those are some of the benefits of male circumcision.
Ivela kangwane li achieve 95.
Yeah.
It's a milestone. Lenhle kakhulu Ministry of Health
Yes.
yayimemethela ukuthi livela kangwane selifike kule milestone le. Nithi khanza nidlala enzima yini nine in terms of voluntary medical male circumcision and looking at the footprint that you guys have had.
Okay. One of the things that we need to say, it's not just the 95. We also have other 95s, because these 95s that we are talking about, we're talking about people who know their HIV status. We're talking about those that are on treatment.
And
We are
those that
also
have
talking about
suppressed.
viral suppression. But then there's also 95% of the people who test HIV negative, who are then getting the HIV prevention services.
Okay.
So we're pushing that one as a country. And it's not just male circumcision. It's male circumcision, kunabo PrEP, kunabo condom use.
Yes.
We are pushing those things. So if people are not getting HIV, it means they are taking one or two of the HIV prevention, of which male circumcision is one of those. So with male circumcision, sitawubuka HIV incidence.
Yes.
Sithi HIV incidence in Swaziland is going down nyalo. Sisuka kushims 2 wa 2016
Yes.
besiku 1.13. But nyalo sesiku 0.62. Lokusho ukuthi currently we have fewer people getting infected with HIV. And why are fewer people getting HIV? Now soke labafana labanengi. Labatabe sesebahamba bayolala labantu. If ungayitholi wena HIV, ngalokuthi ureduce ama chances zokuthi uyithola ngalokuthi usokile. Kusho ukuthi lo utawulala naye. So vele so protected because wena awunayo HIV. So now ulala naloya kana awunayo ngeke uze uyitransmit. But if you have more people getting HIV, it means we'll have more people getting infected with HIV from the guys that are getting HIV. So
Dokotela-
isithe lapho bese.
Dr. Bongani Masango, Bongose, sisaqhubeka. He has a lot to say. Bapusha indaba ye-advocacy kukuthi sive semaswati asisonzele bakhona ke la emavuso Trade and Exhibition Center bakhona la sikhona khona singumsakazo wesithombe ye-Eswatini TV bayatholakala ngale ekhoneni nabafika khona bakhulumisa Donald indaba ukuthi ingabe besowusokile yini soka uncoba kanti lesikhathi samanje sitawukhulumisa just one last point Dokotela indaba ukuthi the importance of companies to support indaba ye-voluntary medical male circumcision ukuthi tinkampani nato tibone tigcugcutela tisebenti tato ukuthi atihambe tiyosoka and also ngidafuna ukuthi isicoveration indaba ukuthi tathi lo mnye ngiyasebenta
Okay.
ihamba kanjani ngidacela ukuthi usichazele lapho but asicale nganayi the importance of companies supporting EVMMC.
Okay, one will say your health is your wealth. If you are a company that's looking at getting enough benefits from their employees, they need healthy employees. Then one of the things that are affecting, we have been affected by HIV Gangwan. So if you have employees that say are HIV infected, ukhanza ukuthi sekunetinvo lokhanza ukuthi the malanga la katawa lova sekumele hamba yothatha treatment. There are a lot of things. So if they invest into prevention, they will be investing into benefits. So one thing that sicela kuma companies ukuthi they should uniketa lama mails isikhashana nje lesincane longakasoka ahamba yosoka because now soke namuhla in the next 2 days uyabuyela emsebentini. So sincane kakhulu lesikhathi losihlalako. The healing process is 6 weeks, but lokuthi ungakhona kwenda other physical jobs in 2 days usoyakhona kwenda ubusoke namuhla.
Dr. Bongani Masango suka lapha voluntary medical male circumcision ngaphasi kwelitiko letempilo. Sasichazela, he has a lot to say kanti ke ngwane lo muhle wena don't worry if you feel like you have still more questions and answers that you need to be given by Dr. Bongani Masango. Don't worry, we still got you. Careful. This is Eswatini Trade and Exhibition Center. This is Eswatini International Trade Fair. Let's take a quick commercial break. Masbuya.